Hi, my name is Felicia Ellibert, nurse and CEO of Cleansing Waters Wellness Center. So by now you've probably received your dose of semaglutide. You should be very excited to get started. We are excited for you. Right now, between all of our locations, we probably have over 1,500 patients on our program, and everyone is doing amazing. Your results are going to depend on you and what you put into it, okay? So for starters, let's talk about possible side effects. Not everyone will have side effects. Some people have minimal, some people have a little bit more than minimal. We really don't have patients who's had just major side effects from the medication. So one possible side effect is nausea. Anytime you start the medication, you may get a little nausea the first day and maybe even the second day, nothing much. If you do, there's a medication, it's over the counter. You can get it from Walgreens, you can get it from CVS, Walmart even has it, but it's called Emetrol, Emetrol, and it's just an over-the-counter medication for nausea. I would not run out and get it now because, like I said, a lot of times you may not even experience any nausea, but if you do, then you can go out and get some. Also, a possible side effect is headache. Now, again, don't think that once you get started, you're going to have a headache. If you do, it's normally like a little naggy headache, just enough for you to know that it's there. And if you do experience headaches, you can just get a couple of Tylenols or ibuprofen and it will knock it right out. Also, a side effect that I see more common is constipation. Now, what semaglutide does is it slows your gastric system down. And with that being said, it slows your bowel movements down. So a couple things you do is really stay hydrated. We should be drinking at least 64 ounces of water a day. That helps. Also, fiber helps. What I will say go out and get almost immediately is a stool softener. Now, we have stool softeners here in the office. If you want to grab a bottle from us, then just let us know. Just call the office, let us know. You can either drop by and pick one up, or we can stick one in the mail for you. But anything like maybe Colace or Ducalox, just something, not a laxative, but just a stool softener. Start that almost immediately and just do like 1 or 2 a day while you're on your program. So those are the 3 most common side effects. Again, it's a little nausea, constipation, and headache. Also something that we should go over is your diet. Now, your diet will be low sugar, low carb, and high protein. Again, that's low sugar, low carb, and high protein. Your medication normally will take your first dose a couple of days to really kick in, and you should really notice a difference in your appetite. Now, on the medication, you will still get hungry, but you won't be able to eat nearly as much. You will get full pretty quickly. Now, with that being said, it's very important for you to eat at least 3 to 4 times a day. Again, you'll get full fast, so protein is super important. I would go out and get protein shakes, okay? Anything that has at least 30 grams of protein will be great. So you can start off maybe having a shake for breakfast, maybe even one for lunch. But I would recommend at least 120 grams of protein a day. So if you have maybe 1 or 2 shakes a day, you can supplement your protein with your meals, chicken, fish, beans, anything that's high in protein. One tip that I want you to keep in mind as well is that when you get to the point where you're not able to eat a lot and you're eating a meal, always start with your protein first. So for an example, if maybe for dinner, if you're having chicken, maybe a little rice and a salad, start off with your chicken first, because 9 times out of 10, what will happen is you will take a couple of bites of a potato or rice, or maybe even start off with a salad, and by the time you get to your protein, you're already full. So you won't be able to eat as much. So always keep that in mind when you're eating. Protein, protein, protein. Okay, something else that's really crucial to your weight loss journey is exercise. Now, I'm not saying go out and join a gym and work out 6, 7 days a week, but if you can commit to at least working out maybe 4 or 5 days a week, um, a nice 45-minute walk, 30-minute walk in your neighborhood. If you go to the gym, you can do, some elliptical, maybe a little treadmill. Weights are okay. You don't have to do anything heavy. 10, 15-pound weights is good. Just movement, movement, movement. That's going to actually enhance your results. Also, something that I would like for you to do starting today is journal. I want you to take your weight for today's weight, write it down. Also, have a family member and take pictures. Nice before and after pictures will be great. So a picture from the front and maybe from the side. If you're able to, you can also measure your inches. That's kind of optional if you like, but just know that it just kind of helps you keep track of your results. But definitely go ahead and weigh yourself and take pictures from the front, and both sides will be great. Okay, so now for the fun part. We will start your medication and your dosing. Now, just remember, the day that you start your injection is the day that you will do it every day. So if you are on our 12-week program, that means, and today is Monday, that means every Monday for the next 12 weeks you'll do your injection, and so forth for the 8-week program, okay? Now, normally we will start you off, and if you're telehealthing, we'll just have you draw up 12 syringes. But what we're going to do today for this purpose is we're going to do just one injection. Most of the time, we'll start you off with 15 units. So we'll go ahead and I'll show you how to draw up 15 units. If you have any problems, then of course we'll talk a little bit afterwards on our call. But this is your medication. All right, this is a vial of medication of semaglutide. Yours should look like this. If it doesn't, then there's maybe 1 or 2 other variations that we may have. But basically, this is what it'll look like, okay? Now, you'll wash your hands and you'll peel off the top. Now, I don't know if you can, I'm going to kind of pull this close, but I'm going to peel off the top here so that your plunger is exposed. So I just peeled off the top. Okay, now what you're going to do is, here's your syringe. All right, so you'll take off the cap of the plunger, and then you'll also expose your needle. So this is what we're gonna eyeball. Now on here you'll see the calibrations, and you'll look for, we're going to do 15. So there's a number 10 and then there's a number 20. So our 15 is going to be right in the middle of the 10 and the 20. Okay. So what you'll do is you'll take your vial of medication. You're going to stick the syringe right into the needles right down into the plunger. You'll flip it upside down, and then you'll pull back slowly. Now, sometimes what I'll do is I'll pull back, like right now, I've pulled back to 20 just so that I can clear the air bubbles out, and I'll push up to 15. Okay? After that, that probably shouldn't happen, and I'm not going to do this video over, but we have 15 units here in this syringe, and then you'll recap. Okay? So, again, you'll start off with 15 units. We will have a call more than likely after you've watched your video and you have more questions. This is just kind of like an informational video. When it comes to doing your injections, I will go ahead and I'll post another video attached to this one just to show you how to do your injection. Most of the time, I would always say do it on your stomach. It's a sub-Q injection. That means subcutaneous, right below your fat. And I will always say do it on your abdomen, on your stomach, okay? Now, you don't have to alternate sites. If you do it on the left side of your stomach, if you feel comfortable the following week, stand on your left side, you can. So the most important thing that I want you to remember when you're doing your injection is it needs to be at least 2 inches away from your belly button. So you could inject anywhere on your stomach that you're comfortable with as long as it's 2 inches away, okay? Also, once you do your injection, something else that's really, you can't mess this up, okay? What's really important is that once you do your injection, you poke, you go in pretty quickly like a dart, you inject. Don't pull it straight out, because if you pull it out immediately, you may get a little medication seepage and you want all of your medication. So once you do your injection, just wait a second or two and then pull out. And that's it. So it's just that simple. Again, I'll attach another video just to kind of show you how the injection is done. Okay, so that concludes our video. I am so excited for you. I'm excited that you've chosen Cleansing Waters to be a part of your weight loss journey. Know that you have made a great decision. This medication is definitely a game changer. We've been in the weight loss industry now for almost 19 years. And honestly, I've never seen a medication so effective. And not just effective, it's something that you can rest assured that's safe and it's healthy for you. It's going to promote your health. It promotes your blood pressure. It promotes your A1C. It helps your A1C level. It helps with your cholesterol. So just know that you are in great hands. We are here to make sure that you're successful. I'm personally available. If you need to speak with me, just call the office. You have the number. It's 770-507-2805. Ask to speak with me. You can make an appointment with me, and I'd be glad to discuss and to go over, the program in more details if you have more questions. But again, thank you, and I look forward to working with you and talking with you soon. Bye.